this could become something that starts to spread within communities. One person spreads it to 3 people, those 3 people then spread it to 3 more each, and so on. And when you start to get generational spreading like that, it's going to be something that's commonplace.
Hey everybody, it's Aaron Ball here in my office. Today is February 28th, 2020 with another daily virus health update. I'm doing these for a month just to keep family and friends in the community updated. I wanted to start with Dr. Sanjay Gupta's comments and also lead into some discussion I found valuable about mortality of this virus and lead into what we should do to be prepared. So check that out.
Does this become another pathogen that is circulating around the world like H1N1? That's what we're hearing. Luckily, again, it seems that the vast majority of people will have minimal or no symptoms. But this could be something that we deal with as a world now in the weeks and months going forward. If we start to see community spreading, then there's this term that public health officials use called social distancing. Distancing yourself from people at that point, staying home maybe from work, keeping the kids from school, looking around your house and saying, look, if we do get into this point for a couple of weeks where we're worried about community spread, do I have enough supplies in the house to be okay? Do I have my prescription meds? Do I have kids supplies? Hospitals are going to need to think about this in terms of surge capacity within hospitals. So all these different things go into place. I do want to give context because all that sounds really scary, and I get it, but keep in mind that for the vast majority of people, even if they do get this infection, they will have minimal or no symptoms. 80%, according to some of the largest studies, have minimal or no symptoms. People who are more likely to be really affected by this are people who have pre-existing illnesses, people who are elderly, similar to what we see with flu.
The World Health Organization just raised the threat level from high to their highest level, very high, really indicating the escalation of this crisis. The Dow Jones and stock market is down over 3,500 points, the single largest drop since the Great Recession this week, wiping out trillions of dollars in market cap. This is a really big deal. I found this summary by CNN about the spread of the virus and market impact really, really interesting and valuable. I'll roll that now.
There are more than 82,600 confirmed cases worldwide. This is a number that is growing and could be much higher unofficially. The virus has killed more than 2,800 people. The head of the World Health Organization says the virus has pandemic potential, but adds, quote, "This is no time for fear. This is a time for taking action to prevent infection and save lives now." President Trump named Vice President Mike Pence as his point man for the administration's effort to combat the coronavirus. At this news conference yesterday, the president said the U.S. is really prepared and that he hopes it doesn't spread. But members of the administration also say the risk has the potential to change quickly.
I'm going to be putting our Vice President Mike Pence in charge. And Mike will be working with the professionals, doctors, and everybody else that's working. The team is brilliant. I spent a lot of time with the team over the last couple of weeks, but they're totally brilliant, and we're doing really well. And Mike is going to be in charge, and Mike will report back to me.
In the United States, there are no deaths from the 60 cases across the country, but as with any virus like this, it is unknown how many people might have it and not even know it right now. In Sacramento, California, there's evidence of a first patient contracting the virus without traveling to another infected country. And this is important because experts say this kind of community spread can be the tipping point that leads to a pandemic. In the meantime, other countries are taking drastic measures. In Japan, they're closing schools for all of March in an effort to protect vulnerable children. And Iran has closed its borders to all Chinese citizens.
So stay in touch. Like I said, I'm not a medical expert. I'm in no way sharing this information to be alarmist in any way. I just find that I'm consuming and researching information. I wanted to suss out what is reputable and present it to my family and friends. Please give me information and links to content that you find valuable. Share it with me. I'll try to include it in my daily update. Please share this with family and friends if you find it valuable, and be in touch. Thank you.